Thank you for joining Congressman DeSaulniers' virtual town hall on the recently passed Republican budget bill. My name is Janessa Oriel. I am the district director for Congressman DeSaulniers. I want to share for those attending that we'll be taking questions through Zoom and YouTube. To ask a question through Zoom, please submit it through the Q&A box at the bottom of your screen. And to submit questions through YouTube, please add your questions to the comments section. I will now turn the town hall over to Congressman DeSaulniers.
Thank you, Janessa, and thank you for everyone who's shown up for this virtual town hall. I want to thank my staff for setting this up just in the last week after we voted on the big ugly bill, as I refer to it. So we wanted to take this ability to do it virtually so that you could be updated as we get more information about it. The process of this bill coming into effect was jammed through both houses of the Congress, in my view. It gets frustrating going through the process, I know, to some people because it takes longer, but it allows for more transparency, more evaluation. And this is definitely not the way to do what is one of the biggest pieces of legislation in the country's history, with a significant potential effects, both directly and indirectly. So this will be the first of many. We'll do some specifically on particular elements that we'll talk about today, but I wanted to take this opportunity to sort of let you know what I think is the most challenging parts of the bill. We're supposed to be in DC this week, the regular calendar, which is available online. We would have been in the District of Columbia working this week in Congress, but because of the process last week, the 4th of July was the normal break for Congress, so we could be back in our districts for the national holiday, but we were called back and went without sleep for most of the 48 hours that we were there. And then I flew back and started to go out and do district things this week. So we have been out in the district today, did a ride along with the Antioch Police Department, went out and had a wonderful meeting with the providers at the Brentwood Health Clinic, a wonderful clinic that's part of the Contra Costa Health system and the Contra Costa Health Plan. So with that, we're going to go through the PowerPoint. It'll take about 15 minutes. As always, and probably more than usual, there's a lot of detail in this PowerPoint. So if I could go quickly, just as I always tell you who join us for these town halls in person or virtually, that they will continue to be available, the PowerPoint, on our social media and on our webpage if you want to go take a look at it. Or if we're going too quickly, you can bring this up on your computer or cell phone, and you can slow down or speed up based on how I go through it. So with that, let's go ahead, Kaylee and Janessa. This is our first slide now. Always, since January 20th, we want to be very careful that you understand the constraints we are under. Because this is taxpayer funded, I cannot campaign on it. So if I have opinions, they're within the restrictions, as I understand them, of our ethics rules. And I hope you all can understand the tax funds are paid by Republicans, Democrat, declined states, all kinds of party taxpayers, and that's the venue for this. I can express my opinions as to why I voted the way I did, consistent with how I get elected and reflective, I think, of the majority of the voters in my district. So just wanted that disclaimer. If I was on a campaign town hall, then I could be as political as I wanted to. So with that disclaimer, and I know it's sort of a hard line to follow because politics and policy obviously are very much integrated, but there is a fairly obvious one when people are obviously campaigning on, at least from my perspective. So this is just an outline, the first PowerPoint of how we understand the consequences. These numbers are primarily from the Congressional Budget Office. The Congressional Budget Office is deliberately set up to be non-political and non-partisan. So this is their analysis. I would suggest you go to their a website. They really do a wonderful job. And there's a lot of institutions in American democracy that do this. In my former job in the California legislature, the Legislative Analyst Office in California has a deserved reputation for being nonpartisan, as does the Congressional Budget Office. That doesn't stop people from criticizing it, and that's a human institution. Sometimes they're wrong, but this is their analysis on a Republican bill. So they don't get hired by Democrats, they get hired by the whole House and Congress, Senate and House. So by their estimate, 17 million Americans, this is continuing to adjust based on more and more factual evaluation. And again, as I said in the opening, if the bill had gone through a normal process rather than be crammed through the way it was, there would have been more accurate analysis when we voted on it. That's the reason why we have the Congressional Budget Office. So all of us can take a look at what the professional analytics are based on their requirement to be nonpartisan. Take school lunches from 18.3 million children. Healthcare, that's mostly, it's Medicaid, but also cutting Medicaid because our healthcare system, the way it's set up, Medicaid, Medicare, and private employer-employee healthcare all have interrelationships, just because the way people get sick and where they go to get services and how we provide, as a country, how we provide compensation for the providers. So that's whether you pay as an employer-employee into a private, that's separate from what's in the bill, but it still has an effect because Medicaid is so big. Pell Grants are something I've spent a lot of time on. I very much believe in them. These are federal grants for people who qualify and can't afford to come up with the money because they're not wealthy enough to get money or scholarships or loans. Pell Grants have been very effective. The analysis on Pell Grants is for every $1 we spend, we get $2.50 back from the return on investment, investing in talented people who get into school but don't have the financial resources. We all benefit from that. They go on to be doctors, lawyers, teachers, all kinds of professionals because they get the education that they deserve and we deserve as Americans to make sure the most talented people get the education that helps them, but also helps all of us. It increases most tellingly, and we'll go into this more, by $3 trillion. Very strange to hear people on the other side of the aisle talk about how our debt and our deficit are too high. I agree that there are times that they're too higher. Proper financial management, I learned by owning my own businesses. There are times you need money, you need to borrow money. There are times you should not, and we are at a time where we should not, in my belief. We will show, there are plenty of studies that show actually the deficit has gone down during Democratic administrations and got up during Republican administrations. My own suspicions for that is the Republican Party that I left 20 plus years ago has become more radicalized in my view. The people who support their campaigns frequently benefit from a high national deficit, in my opinion. So clean energy credits, very important that they're taking away, that we've put a lot of work into. And because of that, it's raising our cost of energy and particularly electricity costs. So all of this is analysis of going forward. You won't see these today, tomorrow, or next week, but you will see them over the course of the next 5 years or so. And all of this is to pay for the largest tax cut in the country's history to the wealthiest Americans at a time where we have the highest concentration of wealth in the top 1%, top 10% history of the country. And you've heard me say many times, this is the underlying problem. We have some interesting graphs to that point, so I'll save more of that. And we're going to add more money to countries to spend on their own military. So that is not a bad idea. We have partnerships, and I think that everybody should share the cost of defending the peace on this planet, and obviously Americans, but not just Americans, but predominantly Americans. Next. Let's see, we're still in the same slide. This is specifically to the East Bay. and specifically to the district I'm so fortunate to represent, California's 10th congressional district, about 750,000. There are 435 House districts in a country with 320 million residents. And just in this district, it is the fifth wealthiest district in the United States, the California 10th district. 131,000 of those 750, roughly, people who live in this district rely on Medi-Cal, which is California's description of Medicaid and Medicare. So we're going to 131,000, according to the analysis, will lose their health care. And 18,000 households who rely on supplemental nutritional programs, they qualify for them, will also lose their benefits. Again, these have had a lot of peer-reviewed, nonpartisan, both government and private sector foundations have reviewed these programs, and they are of benefit to all of us, particularly young people. When they get the nutrition they need, their cognitive development, we know science tells us, improves, and we all benefit from that because they go on to be sustaining, successful members of American society. For those who cannot, for whatever reason, those are legitimate considerations of how we take care of them, but also they take care of themselves and provide within the conditions of their living experience for all of us. ICE's presence in Los Angeles since recent activity in Concord. I have been down to the Concord courthouse to sit anonymously. You're allowed to do this as a citizen, not as a member of Congress. I've just walked in to sit and quietly listen. Not trying to draw attention to myself in these instances. I just want to understand. I believe in lifelong learning and learning by going out and seeing. So I've been down to that site. I know what's going on in Southern California. My own belief is that the President of the United States is taking advantage of our lack of immigration policy in Congress. Again, you've heard me talk about this. There have been multiple efforts to pass, bipartisan efforts to pass congressional legislation that would help deal with our problems at the border and with immigration. And I don't believe in open borders, but I also believe in the needs of this country require immigration, and they always have. Most of us, almost all of us, are immigrants to this country, unless you're a Native American. My last name, my forebears came from Canada and from France, and then predominantly from Ireland on my mother's side and on my dad's side. And there's a little Native Canadian in there, I'm told, but I've never determined that to be true. So that's just the family lore. But the point being is we rely on immigration. We're a country of immigrants, and we've got to manage it better than we currently have. But what the president's going about on in Los Angeles, I think is extremely dangerous. And my belief is he's trying to create a conflict where he can declare the Insurrection Act. And I'm afraid he'll try to do that nearer to the end of his term. So we have to be aware of that and fight that. So he could get around the term limits for president if we get in a conflict and he signs that, the court support it, he can stay in office, pass the election, and nullify elections. But clearly there is not an insurrection in Los Angeles. I really want to commend the city leaders there, Karen Bass, who was a former colleague and a dear friend in a very difficult circumstance, in the Los Angeles Police Department. And the United States Marine Corps and the National Guard that's there, I feel like they should not be there. They're being used by the President of the United States in a situation that they should not legally be there. That's my feeling. And then on the clean energy side, we've spent a lot of time on that, something I take pride in my involvement on. Very dangerous what they're doing. And I will tell you right now, there's just a recent article in, I think the New York Times, might have been the Wall Street Journal, about how the Chinese, they are leading the world now in auto manufacturing. Just 10 years ago, Tesla was there and it was popular. They now have a product that costs $10,000 a year that gets longer range, and is of as high quality as Tesla and outsells Tesla there. It is subsidized by the Chinese government, but we have to be very concerned that the only reason why they're not selling here is because of our tariff barriers, which I agree with, but we have to really be smarter about investing in clean energy and renewable fuels and alternative vehicles, of which I'm proud owner of an electric car. Next. So these are the graphs we'll get into. It's just fairly self-explanatory. These are also source identified in the bottom of where we got these. These came from a very extensive article 2 days ago, I believe, in the New York Times, but they're all of what they got. We've identified where they've come from. They're nonpartisan, well-respected foundations or the Congressional Budget Office. So the biggest problem in this country, I believe, is inequality. Lincoln famously said, I use this quote often, that labor, meaning wages, and equity, meaning investments, must always be balanced in America. If equity ever gets the superior to labor, we will have lost democracy. Well, in many ways, we've lost democracy because of campaign financing laws, the Citizens United decision, and how campaigns are funded. There's a direct correlation, and not necessarily not just plain not a reflection of what our constituents as a Congress in the whole want us to do. So this concentration is wildly dangerous for American democracy, and there's not just Lincoln, but a lot of people have written on this. Thomas Piketty, most notably, getting the Nobel Prize for his work on comparisons of capitalist societies, and this is our biggest danger when we get this level of concentration. It inhibits opportunity and talent from hardworking, talented people from being able to move up and take care of their family, but also contribute to society. We also know from research, Piketty's and others, that people who make obscene amount of money and are protected by, unfortunately, our political system right now, don't spend that money out in the free market the way middle class people do. So this just is illustrative of the challenge that we have, and this bill will add dangerously to it, in my view. Next. Oh, so this is the effect on healthcare. And if you don't see this identified in a footnote, we will put that all available to you. And we will make sure we do that always on our website. So if you question if I'm making these numbers up, I want you to be able to see where we get the numbers from. They're not from me, they're from third parties that are generally regarded as nonpartisan and that I respect. So this is just talking about what I already talked about in the opening statements, and the $17 million, 17 million Americans, and 133,000 who will lose healthcare in my district, and 17 million nationally. So you can see after the Affordable Care Act happened, you see that line that comes down, then we increased the number of people who had healthcare, mostly employer-employee, and this has been one of the current president's targets. And the Republicans, they want to undo the Affordable Care Act, otherwise known as Obamacare, which was such a success. We should build on that success, and they're actually taking away much of that success in this bill. Next. So the budget bill and the economy, again, you can see the footnote as to the analysis. It's not going to stimulate the economy, according to professionals. Do you get a little bump because there's more cash involved, as most Americans do get a tax cut, but it will be limited because of the effect on the overall economy of less money being out there flowing throughout the economy and more of it being concentrated in people who invest in high-end investments. And they tend to keep that all within the top 1% or the top 10%. And again, that's research tested, but we can provide more information if you would like, and you can ask us for that. It'll also be available on our website. Next. So this is the impact on the federal budget. I said this earlier. The Republicans are supposed to be the fiscally responsible party they once were, they no longer are, clearly. And you can see the concentration here in this graph of who benefits from these tax cuts and how they affect on the federal budget. So it'll give some benefits to middle income people, but they will be very transitory. In the long run, they will end up paying more because of the financing on the deficit. We have to go out and finance this. It's putting more money on the proverbial credit card. $3.3 trillion over the next 10 years. This is dangerous territory when you compare our percentage of debt and deficit to other developed countries as a percentage of the gross national product, GDP. Next. Again, federal budget, you see these are big bills that we've passed in the past. The blue ones are ones that were passed by Democratic administrations and Congresses. The red are from President Trump and Republican-controlled Congresses. In the now 6 terms, I've been in the House of Representatives, 2-year terms. I'm in the middle of my 6th term. There's only been 2 terms where one party had control, now 3, of the White House and both houses of Congress, and then these are when these were passed. I would say the 2 that you see in there in blue were really wonderful, historic bills. I was very involved in that smallest one, the infrastructure law, because of my background in transportation and infrastructure, having chaired both committees in the legislature in the biggest state in the country, in California, and being a senior member on transportation. I have a number of initiatives that are in that bill. It's going to be very good for the economy, and the civil engineers of the United States estimate what our deficit is on infrastructure every year. Again, a nonpartisan group. We had a huge deficit on our investment in infrastructure. This was a very large contribution to change that and also have huge multipliers to the economy. Republicans and Democrats have tried to do that, but President Biden and we did that successfully. And that money is starting to flow out. Big commitment to the 680 corridor that I'm very proud of being involved in, $166 million that will help that corridor, and a lot of our infrastructure all over the country. For every 1 construction job, it has a multiplier of 12 to 14 additional jobs in the local and state regional economies. The American Rescue Plan was done to get us through COVID, the biggest pandemic in 100 years. I think it was very successful. A lot of people didn't like vaccines and being in isolation frequently. It was hard as somebody who's had a weakened immune system, a survivor of cancer. Believe me, I was very aware by my doctors of my mortality. But if I took care of myself, my immune system would be fine and follow the science. And I am here because of that, listening to that advice and the science. My immune system is better than most people of my age. And it's because I listen to doctors. And you can see the other investments, the tax cuts. So tax cuts sound like a good idea, but it depends how you do them. And these are very poorly done in my view. Next. So we fought these cuts and this bill very hard. I'm very proud of the work that I did and our colleagues. I will admit that when January 20th, we were a little shell-shocked. We didn't think he was going to get elected. And although we were prepared, we weren't prepared for how bad he was going to govern, and we should have been, quite frankly. What he has done in this term is exponentially worse than the first term, even though that was horrible. But we fought hard, and elections do have consequences. So we have to fight to win elections, obviously, but we also have to fight in the courts, and we have to fight in the Congress, and we have to try to persuade Republicans and fight them to vote against these horrible bills. So far, they have been afraid to do that, in my view, because they're afraid of President Trump and being primaried in such a way that not only gets them defeated, but also is disingenuous, dishonest, and has unfortunately made legislating from the Republican side a very difficult thing to do in a way that actually works for everybody's benefit. And I was proud to be on the floor. I was proud to be in the Senate. when Cory Booker stood for so long. It was very inspiring to hear him. He did a great job. But likewise, our leader, Hakeem Jeffries, with very little sleep. We were on the floor watching that. I mean, I thought he did a great job. And then Speaker Johnson got up and said it was a waste of time, which was galling. But we're learning and we've got to get better. And we've got to work also with you on the outside to convince the American public that this is not the way to govern for all of us, Republicans, Democrats. And we've got to fight like hell, pardon me, when we disagree with it. And that's in the Congress, in the courts, and on the streets. Many of you know I've been out on the streets with our friends demonstrating against many of these cuts. Next. So this is what comes next. We've got things like the federal judge blocking a provision and bill cutting off Planned Parenthood funding, a wonderful part of our community that provides really necessary healthcare services. And it's not just about family planning and abortions. They do all kinds of healthcare, and they're very good and efficient at it and effective. So these are all the things we have to fight, and we have to fight at the ballot box. Next. So here are our offices. Please feel free to contact us. And with that, took a little longer than I should have, but the next 35 minutes we'll be answering questions.
Excellent. Thank you, Congressman. We'll now move into the question and answer section of our town hall. As a reminder, if you'd like to ask a question, please use the Q&A function at the bottom of the Zoom screen or submit your questions through the YouTube comments. Thank you. Let me jump over to those questions. Okay. Question from Anne. How and when will we know what the Medicaid cuts will be to long-term care patients like my 87-year-old mother who is in Danville in a skilled nursing facility? She pays her share of the cost, 95% of her income each month. We would not be able to afford her care if Medicaid is cut in any way. We would like to prepare. Can you give us an idea of how these cuts might proceed?
So earlier today, we were actually out at the Brentwood Health Clinic, as I mentioned, meeting with providers there. And this was a good part of the conversation, just because of their concern of where do people go. And I can relate to this because my dear departed mother lived to be 95, but lived in Marin, and my brothers and I, sister, helped to make sure she was in facilities for the last 30 years of life that she qualified for. And I very much can relate to your situation, trying to make sure she got the quality of care I wanted, that she qualified for, and then what we could afford. So it's a real concern. It's one of the things, so the next process is when we go back next week to the Congress to be in DC on Monday, then the appropriations process begins. Normally, that would be the place where a bill like this would be fleshed out. So it'll be very interesting, and please stay in touch with us to see the Appropriations Committee chaired by Tom Cole from Oklahoma, who I served with on the Rules Committee for a number of terms, somebody I have a relationship with, to see how they manage this, because this, of course, is an issue for Americans in all across the country in every district, Republicans and Democrats, and it's obviously very sensitive one. We don't do a good job in this country of taking care of our seniors, so we don't do a good job to begin with, in my view, and this could really make it worse. So that's the long answer. The short answer is please stay in touch. This is one of those things that we will continue to monitor, but it's to be determined, and it's very hard for you to prepare, as it is for us, both personally and professionally, to stay on top of this. So this comes through, goes to the state. The state will delegate where they're going to make adjustments in their budgets to local agencies and to state agencies. And we will continue to work with them as we have for all the time I've been in Congress and elected office, all these different levels of government. That's the long answer. The short answer is just please stay in touch. We'll continue to monitor all of this and provide updates for you on our social media and our website, but particularly this. So that's a way of saying we're not sure. It could be most of these cuts are politically driven not to take effect until 2026 and 2028. So a lot of people will hear people like myself give these numbers about what the cuts are, but it's important to remember, because I think the strategy for the Republicans is, I don't see any change. Well, it won't be changes as much as you would imagine, because it'll be 2026 when they take effect, and 2028. But in the meantime, part of the meeting today with county officials was for us to get prepared so that we can prevent as much of these horrible cuts here in Contra Costa and Alameda County and the state of California, but also to get more information so that as best as we can know when these will happen. The other thing you can do is talk to your provider, to the facility that your mom's in, and for others, your grandparents, for where our seniors are. So have an honest, open conversation with the provider that you're dealing with, and then stay in touch with us.
Excellent. Thank you. The next question is from Vladimir. Why are Democrats not on every media outlet talking about the disastrous effects this bill would have on poor and rural communities in America?
That is a question I spend a lot of time thinking about, and it's a little bit of a political, metaphysical question, if you may. The way we get information now has changed dramatically, certainly in my lifetime, where the old Walter Cronkite model, where you get on local news, you get in the local newspaper. If you got on national TV, that's what happened. But in the last 30 years, that's all changed. And it's changed really dramatically. And that's one of the reasons we're so polarized now. I've had town halls on this and had experts come speak to us. So just because you don't see us doesn't mean we're not trying. And we're doing everything we can to get out there. We know that the algorithms that drive media, and again, I've done town halls on this, spent a lot of time with experts around the country on this, and social media. The algorithms are tied to overstatement. You're more likely to click on something by a magnitude of 40%, almost half, if it's embellished and extraordinary and hair's on fire. It's the old saying in the newspaper business, if it bleeds, it leads. We knew this intuitively. Now we know it because of neuroscience and brain imaging, that we can see where the parts of the brain work on individuals, and we can map that in groups. So that's part of our problem. And the Republicans are very good at lighting things on fire so you get their attention, and then we're the firefighters trying to put it out, my analogy. And if you know a fire, the firefighters don't get as much attention as the arsonist when it all blows up. So that's sort of my analogy. We work very hard at this, and we spend way too much money with experts telling us what to do, who I don't always agree with, because it's all about messaging in a way that I think is shallow. But that's just me speaking. And fortunately, I have a district that supports somebody who likes to go in more detail. But we're out there, we're trying, and we'll keep trying. I'm not saying it's not justified criticism, but it's in the context of and these are all private companies, by the way, so we don't control them. They put what they want on their media, whether it's CNN, NBC, ABC, Fox, MSNBC. It's hard for me to get on Fox because they don't put progressives on. They used to, that changed. I used to go on Fox quite a bit, but they have since got so partisan that they don't ask. And if they did, I'd be hesitant to do it because it's more like a circus. And some people say that about MSNBC. I don't think there's a symmetry between the two. But that's the answer to the question. We will continue to fight for ways. This is one of the reasons I do these, because it's something I can do on my own, and I don't have to have it filtered or try to audition for one of these for-profit stations or newspapers to let me in. And then there's the last part, the ruining of local news. In my time in office has been a real problem, and it's been something I've put a lot of work into. I have 2 bills right now that would help with that. But how you get information is a real challenge right now. And we'll continue to get on every way we can to bring attention to our arguments, whether it's on any of the large media outlets or it's just through social media and town halls like this. So thanks for the question. If you have any suggestions, we're more than open to listen to them.
The next question is from Susan. Rural areas may be more adversely impacted by the budget bill that was just passed. A lot of rural areas are represented by Republicans. How do you explain this discrepancy?
Well, part of this I've already mentioned, but this is what would be interesting to see in the next between now and September 30th, when appropriation should be done. That's when we run out of money, so we would shut down then. So we'll see how they react through appropriations and how they try to change the numbers around with bookkeeping or with actual adjustments. We will argue for those changes rather than just budget gimmicks. But the rural issues are really important. I talked to lobbyists and advocates from public hospitals who, obviously, there's lots of rural public hospitals. They will close. And this is going to be one of the most um, significant impacts is that rural areas, there's a lot of poverty in rural areas. There's a lot of Medicaid. And those are the areas that will be, in many ways, most impacted. The urban areas where 65% of the GDP is, where mostly Democrats live and vote, they will be impacted as well, and we will be impacted. But you're right, rural areas are going to be impacted, and hopefully that's where the political pressure comes from. Having said all that, since Citizens United and cash can go into independent expenditures, that's the monster in the room that's related to inequality. The Koch brothers network or those folks can write checks for millions of dollars for campaign messaging on the news, on the media, which also goes to some of the question previously. The Republicans outspend us on TV, not being suspicious, but since Reagan got rid of the equal time clause, which required if they went too far on being political in news or editorial, you had to provide equal amount of time for the other side to speak. Since he got rid of that, the Congress hasn't been able to reestablish that rule in the Federal Communications Commission. This independent expenditure money makes Republicans, even in rural areas, feel like they cannot lose an election because they'll be protected with hundreds of millions of dollars from wealthy donors in independent expenditures. The only caveat the Supreme Court said to that on election financing laws is the candidate and the campaign cannot talk to them. So you have to spend money in your own restricted, more transparent campaign, but that these independent expenditures, as long as they don't communicate with the campaign, can spend anything they want. And over the last 20 years since the Supreme Court decision has been a flood of billions of dollars by wealthy people to get people to vote against their interests, quite frankly. So a lot of my Republican colleagues are more afraid of that money through the Koch network and Donald Trump's power to go in and you also use large sums of money to get people to vote against their own interests. So it's a real troubling time for American democracy in that regard, and it's very Orwellian.
Excellent, thank you. The next question is from Mayor Susanna Meyer of Brentwood. Have you heard much about the possibility of complete elimination of the CDBG funding across the country? I've heard there will be a vote on July 14th, but have not received many other details.
No, I have not heard that, Mayor, and I was just in town a few hours ago, so I was out there, as I said, visiting the Brentwood Clinic. Supervisor Burgess was there, and in the future, we'll make sure you know we're coming, but we put that together quickly because we weren't supposed to be here this week. So thank you for your service. I have not heard that as somebody who came from local government and spent many hours on CDBG funds as a city council member and a mayor in Concord. And then as a county supervisor, where a lot of the CDBG funds went for cities in the county. It's a good program when it's done right, and we do it right. It's a lot of good oversight, and I'll take some credit for that. We provided more oversight, so we made sure it was performance driven. So those community development block grants normally would be very bipartisan. So the federal government develops the framework, sends them to the local agencies, the state local agencies, and they are able to put those, as you may know, Mayor, into a fit that is consistent with the federal umbrella but then fits the community, because in a country this big, every community is different. So those CDBG funds are really important, and I will fight as hard as I can to protect them, having seen the success they do within our communities. I also have been communicating with the East County Community Alliance, which is all the nonprofits out there. And of course, they go through that process to get a lot of their funding. So we want to make sure we're coordinating. So if you can follow up with this, and we will follow up with you to make sure that we're communicating with you and with the mayor's conference to make sure that as this develops, we're all on the same page. It's really important. We're spending a lot of time on this, working with local government and state government and nonprofits, because it's such an uncertain world. We are your conduit to what's happening, and we want to hear what you're going through, because that provides me with more information, so I can argue based on what I'm hearing from you and try to persuade people to not do that. But CDBG funds, I have not heard that, and I would be really upset if we were going to make that more partisan as well, and if the Republicans and President Trump try to do that.
Thank you. The next question is from Jillian from YouTube. The bill allocates so much to ICE, which is disturbing. The budget appears to be establishing a police state. What can be done to ensure oversight by Congress as a principle?
We've got to win election. We've got to win the midterms. Hopefully Republicans who believe in oversight will stop being so afraid to provide oversight. I served 8 years on the oversight committee, and before it became the circus it is now. But I went to the border multiple times, all along the border, to see what was happening there. In his first term, it was awful, and now it's worse. And I'm getting set to visit both the California border and see what's happening there, and Texas, but we can see it in our own community. So we're looking at what they're doing. It's just awful. This is not American democracy. It's quite frightening. Do we have a problem in immigration? Do we have a challenge to make it work for everybody? Yes. I don't believe in open borders. I've never heard of anybody, in spite of what the right-wing media claims, who believes in open borders. We have to have an intelligent immigration system that works for everybody. We also know, as I've told you multiple times, people, we have a history of multiple bipartisan bills being stopped. Most dramatically, just recently, President Trump, when he was a candidate, said that he didn't want a bipartisan bill to help address immigration, so the author withdrew it. The most famous one that was really still is would help a great deal was just before I got into Congress. It was called the Gang of Eight, passed on a bipartisan basis out of the Senate. John McCain and the current Secretary of State were co-authors of that, with Senator Durbin and Senator Schumer, the two Democratic leaders. And we know from John Boehner's autobiography and what he said happened. Mark Meadows in the Freedom Caucus went in, representative I served with, who's no longer in the Congress. He was President Trump's chief of staff. In the first, he went in and fell on his knees and prayed to Secretary or Speaker Boehner to not let us vote on in the House. It didn't, so it died. So all of this money that's going to ICE and the money that's going to border security is open check to this administration. The Congress is, Article 1 says, we and the House of Representatives is where the purse is. This Republican speaker has abrogated that and given it to the president, and particularly on this, it's just a blank check. So do we need immigration? Yes. Do we need immigration reform? Yes. And it should be bipartisan, but it's been stopped by outside groups. Steve Bannon, in particular, an advisor to the president, is publicly written about this. They don't want a solution. They want to have this conflict that's based on racism and fear and not fact. And if they would stop, or if we get control, we could have a thoughtful immigration policy that didn't just give a blank check to the President of the United States, to have ICE agents wandering around all communities in this country with masks over their face and not proper identification, beating and arresting people. It's quite frightening, to tell you the truth, and it's very reminiscent in my understanding of history of the 30s in Germany.
Thank you. The next question is from Peter. What legislative steps are you advocating to counter the bill's devastating impact on the most vulnerable? And do you agree that measured responses to the Republican assault on democracy are woefully inadequate? What concrete, actionable steps are you advocating to blunt this assault on democracy?
Yeah, so great question. I won't take up all the time explaining every bill I've introduced. I've introduced a lot. I've been very fortunate to get over 60 legislative efforts passed into law. I'm very proud of them all. We need to be more aggressive, and we're in the process of basically doing an American Democracy Bill of Rights. Um, we're basically doing a whole thoughtful thing based on my area where other members trust me, Democrats, but so on education, labor, and on ethics and transportation and infrastructure, but also on oversight. So you will see more of this. Some of it is developing, and from a strategic standpoint, I want to give all the details until I actually get them in print. But if you have ideas, we're more than willing to discuss them. We have to The biggest things is just change the tax code back to what it was in the 50s, where it was more progressive and less regressive. So you can go after loopholes in the corporate taxes, of which we've created many for donors to campaigns and across the board, but particularly on the Republican side. And you would increase the income tax so where it's progressive the way it was when Dwight Eisenhower was. So you bring those marginal rates back, and then you protect the middle class and poor people as best as possible as we used to. All of that are bills. You can go to our website and see what we've got. We keep every bill we've introduced and every bill we will. But this is a great question. We have to become much more aggressive. I would do a carbon fee rather than cap and trade. So just do across the board carbon fee for our energy needs. And that is a much more effective way to deal with the true cost of pollution. On the healthcare side, I would do universal healthcare. Every other developed country in the world has it. We don't. And they all have lower cost and better outcomes. The Germans have a particularly good, I think, health system where it's universal healthcare, including behavioral health, which is important to me, so that you would get a base rate of coverage, and then you could buy up more if you had the money coverage. But I have bills to that effect, and we'll have stronger ones in that regard. On the education side, we would protect the nutritional value based on evidence-based research. I have bills in that regard that we're developing in current bills. And then Pell Grants, I've done a lot of work on bills that we've already got passed, expands where Pell Grants can be, expands the number of Pell Grants and how it can be used, because we know that people who don't have a lot of income have problems with housing and food when they go to school. I sat in sessions at UC and around the state and the country where these talented young people who will be great, again, doctors, researchers, teachers, but they can't afford to stay in school even when they get the tuition paid for. So my bill expanded that for consideration for housing and food costs. So those are just some of them, but it's a good question. Happy to any of your suggestions. We've got a lot of them. They're very aspirational, but I think this is something that we Democrats haven't done enough of, along with the previous question of explaining that we believe in the New Deal, and we believe in a New Deal that's supercharged because of this inequality. So when it comes to education, labor, I would expand the labor workforce. I'd make it easier. The PRO Act is a bill that I was co-author of that makes it easier for people to organize, because we know when people organize, they have more of a voice in their say. So based on your question, I'm going to do a whole series and maybe town hall on this, but we'll provide this to you on social media, all the things we've already done, which is still available on our social media and our website, that we've successfully implemented. Every bill we introduce goes out publicly with a press notice, and you will hear a whole series of more along this line. Universal healthcare, easy to organize on the labor side, carbon fee, so that we can really start addressing much more quickly on our challenges with air pollution, public health, and carbon emissions. That's just some of what I can think of right now, and changing the tax code back to one that draws that money away from the concentration of wealth if you have equity and make millions of dollars, and spreads it out to everybody to provide more opportunity for talented people.
Excellent. The next question is from Arnika. How do we fight back on the required sell-off of public lands?
Same way we've talked about on all of these, Congress has to step up, and a lot of this public land is again, obviously in rural areas. So we've got to push back on that. We are. Um, and we also have to protest this. So again, in the courts, because 97% of the cases, if you tuned into our last virtual town hall I had with Democracy Forward from my DC office just a week ago. Was it a week ago? It's all getting blurry. 2 weeks ago, we talked about how these outside organizations have won 97% of the cases they presented since January 20th. In the first term, these groups, have won 78% of the cases. So we are blunting his efforts, but in the meantime, there's a lot of damage done, and we can't stop or let up because he's going to take advantage. And unfortunately, his co-enablers in Congress are going to continue to let him to do this for reasons that I constantly struggle with because it's incomprehensible what they're doing to American democracy. So when it comes to public lands, these are national treasures. And if you know your history, Teddy Roosevelt, a great Republican environmentalist, he started this because he saw the beauty in nature and wanted to protect it. So we have to get back to that. And we're going to fight with it again with the tools we have, but we've got to win elections.
Excellent. The next question is from Linda. Do you see an ongoing DOGE presence in the agencies, or was that a hit and run activity?
That's a great expression. It was an amazing display of arrogance and stupidity. I believe in efficiency. It's something I've done all the years in elected office. Um, why wouldn't we want to make government more efficient? But those measurements have to be accurate for everybody in this country and for everybody who's employed. Most of the public employees I've met, we get great value return on investment as taxpayers. Are there ones we don't? Absolutely. As someone who owned small and medium-sized businesses and had to fire a lot of people, unfortunately, but also had the vast majority of my employees in the restaurant business were my biggest strength because they were hardworking, honest, successful. I have found the same to be true in the public sector. It doesn't have the competitive edge, and I'd like to add more of that without um, running it like a Walmart because that doesn't work. You've got to have employees who you respect and provide value with that respect. And I've never been an employer like that because I realized my success in the restaurant business was predominantly based on the people I hired and I worked with who were my employers. So DOGE was just awful. I can tell you example after example of the pain and suffering and stupidity of it. And we're going to have to rebuild all that pain. And we're working on that nationally. We have a group of labor people. Myself, as a senior member of the Labor Committee, has been involved with that, working with our unions and other affected partners to challenge them in court, but also rebuild the damage that's been done. And if you're a Republican conservative, I do not understand, unless you're a libertarian who just believes survivor of the fittest, which I think is stupid. I don't know who these people call when they get in trouble other than their personal security. Who do they expect? Taxpayers pay for police department, fire departments, the ambulance that comes to rescue you, having been in an ambulance that saved my life. So all of these things, DOGE was not the Department of Government Efficiency. It was the Department of Stupidity. And we're going to pay for the consequences of that and arrogance. So it's one of the reasons I spend my Saturdays generally down in Walnut Creek in front of the Tesla dealership protesting what happened there.
There is time for, I believe, one more question, and this one is from Partha. I'm a longtime resident of Concord and a volunteer with the Alzheimer's Association. You have been a strong supporter in Congress for Alzheimer's research. Now that the big ugly bill has become law, the concern is how it will affect funding for NIH and other institutions doing research on Alzheimer's. Do you believe your Republican colleagues will work with you to restore funding for critical research to find a cure for Alzheimer's?
So what DOGE did has already hurt research. And I'm really worried about young people who I've talked about who are really smart and want to go into all these fields, but particularly research. The National Institutes for Health in Washington, D.C. that I've been to multiple times, and the American Cancer Institute that is as a survivor of stage 4 cancer. I founded the Congressional Survivors Caucus with Congressman, now my co-chair is Congressman Buddy Carter, who I disagree with on most everything, from Georgia. But last time he was president, he suggested cutting NIH and Cancer Institute, and this group actually put more money back in. So Republicans and Democrats. So I'm going to use that as a model. The cuts in NIH are in the president's proposed budget. So this is in addition to what was in the reconciliation bill, and they're horrible. 40% cut to NIH nationally. So the main campus is in Bethesda, Maryland, and then those grants go out throughout the country. The Bay Area is particularly successful at this. Stanford and UCSF are in the top 10 in recipients of this. UCSF is the largest public university that gets NIH funding, including in its remarkable cancer facility. We should really be proud of that. I've been out there multiple times, both at the Panaris campus and the new Mission Bay campus. It's an extraordinary. I got emotional thinking about it. Internationally respected. The Chinese are replicating it. Dr. Collins, who has a wonderful new book out, who ran NIH for some time, and I became well acquainted with him through my work to appreciate and defend them and defend Alzheimer's and cancer and other research they do. So we're going to fight like hell to save it. I've got to fight like hell with Republicans like I did last time in the first Trump administration to get the votes to tell them stop. If you're worried about a primary or whatever, this is too important. These are people's lives. And as many of you know, I am sitting here today because of taxpayers' investments in the Defense Department research and in the National Institutes for Health. The pills I have in my pocket that keeps my cancer at bay came from American taxpayer funding starting after World War I. All that basic research went out, then private companies added to it in many instances. But this is an incredible jewel that the American people benefit from. So we've got to fight like hell, and it will be a priority for me, both for Alzheimer's in your specific case, cancer in my specific case, but for all of this research. And on the behavioral health side, the remarkable things that we benefit from. And Dr. Collins told me when I was a freshman in Congress, the first time I went out there, that the Chinese understand that for global competition in the health research, they want to replicate NIH, and they're doing it. So if we cut it back, it's not only the morally wrong thing to do and will kill people, it's stupid for our economy. We benefit remarkably in America, and as I said, in the Bay Area and California, with these really thoughtful investments in medical research. And I think we do a bad job, for those of us who understand it, the value of explaining it to the American public. There is a challenge of that because Americans distrust politicians and their institutions more than most countries. So sometimes when we market it, there's a pushback against that. So we have to be mindful of that. But we're going to fight like hell, and I will continue to be an advocate for Alzheimer's research. It's on the rise, dementia, all of these things. And as the ranking member in the Health, Employment, Labor, and Pension Subcommittee in the House, I spend a lot of time on these issues, and I'm thankful that you've recognized it. But a lot of that comes from people like yourself who've been in to talk to me and told me your personal stories in your life about why it's so important to you personally, because family members have gotten it and got the treatment, like myself in the cancer case, that have extended their lives. So we have to fight. It's a very, very great question to end on. I hope you can tell my passion for all of this, but particularly in that these are good moral, ethical, and economic reasons to invest in your taxpayer investments, and not what they're doing. It's horrible, it's destructive. People are going to die, and Americans' preeminence in the world is already been hurt by what they've done. And we've got to fight with everything within our resources. I get it. My level of anxiety and concern, and more than concern, my willing to spend whatever time I have alive and whatever time I have in office is to fight what's happening in this country right now and get back to a country where we take care of each other, we respect personal responsibility and achievement, and we want to hold people accountable, but we're in this together. And until the Republican Party comes back to the Republican Party that I used to be part of many years ago, I will continue to fight them with every everything I can and try to get us back on track. So thanks so much for joining us. We're going to continue to do this. I'm so thrilled that so many people wanted to join us, but we can't do justice in an hour. But one last thing, I just want to thank all of you for joining, but also my terrific staff. We've had more town halls than any other member of Congress. Which one is this? 235?
It might be 236.
Yeah.
Apologies.
So we
Yes.
have a hard time keeping track of it, but we do. And the predominance of those have been in person, which I prefer. But we also want to take the opportunity to be able to respond quickly, which this allows us to do. And also is much more efficient on our budget to be able to do it this way. But we have multiple town halls upcoming and they will be in person. So we'll let you know as they come available. Thanks, Janessa. Thanks, Kaylee. Thanks, everybody on my staff and team. I see Team DeSonia. Well, thank you for all the hard work you do. And please, for the rest of the public listening, feel free to send us your emails. We work very hard, but we'll respond to all of them. Thanks.
Absolutely. Thank you, Congressman. As a reminder, the town hall will be available on YouTube and our Facebook page after the event if you'd like to watch it again or share it with your friends. Please do not hesitate to call our office or if we can be of any help to you. Thank you.